Hey guys, so one of the things that often comes back to me when we start taking care of patients is, how often am I going to check your labs? And this is a reason actually I see a lot of clients who come into my office for us to manage their hormones is because they feel like they're not being managed elsewhere. They feel like they don't get the labs that they want when they want them, and they find that they're almost asking their provider to do labs when in general, they've been on medications for quite some time. So how do we approach it? What would be my recommendation to you if you're going to ask your provider to help you manage this? I like to repeat labs 6 weeks after I start therapy. So if I put somebody on hormone therapy or testosterone therapy, I'm going to ask that patient to come back into my office 6 weeks after we start. And I'm doing that for two reasons. Number one, I want to know subjectively, do you see any benefit, right? That's helping me understand, do I need to adjust your levels? But secondly, I want to know, where are we starting to see the levels go to? If we started at low levels or no levels of hormones, then we should start to see this gradual incline with the use of these hormone treatments. After we get you dialed in, then I'll let you go a little bit further out. So I often want my stable patients to be seen about every 3 to 4 months. I don't want you to go beyond 6 months without having your labs checked. And anytime you have a medication change, I would encourage you to get your labs done, again, 6 weeks after that change. So if I've changed a medication or a dosage on you, I'm often going to say, even if you've been a patient of mine for a couple of years, hey, why don't we come back in, let's check these labs again real quick in about 6 weeks. Just make sure everything's looking good and that you're seeing improvement, and then we'll move back to that 3 to 6 month time frame. But in general, you want labs done at least every 3 to 6 months, no farther out than that, so that you can start to see trends and you can actually manage some of these things a little bit more closely, and you've got a provider who's helping you actually provide this level of care. I hope that was helpful. If you've got any questions, please feel free to reach out. Email us at info@optimizehealthnow.com or go to the website at optimizehealthnow.com.